Working in the township of New Horizons every day abruptly thrust us into a reality of abundant illnesses, severe hardships, and the ghost of South Africa's apartheid era. The people we interacted with every day survive off of government grants and free home-based health care. They worry about how they're going to feed their children, pay for their electricity, and make ends meet. After long days of visiting patient after patient and witnessing these trying realities, we would take a 10-minute taxi ride back to our host community of Pletternberg Bay and find ourselves in a completely different world. We felt a sense of familiarity in this affluent community, despite the fact that we were thousands of miles away from home. Upon closer reflection, we were deeply troubled by the stark contrast between these neighboring populations and by the parallels in our own lives.
When we interviewed recent high school graduates in Plet about the AIDS epidemic in South Africa, most of them claimed not to know anyone with HIV, and overall they seemed very detached from what we expected would be an imminent concern. In a recent survey conducted among young people in South Africa, 2/3 of those who tested HIV positive didn't consider themselves at risk for contracting the virus, despite the fact that nearly 1 in 5 adults is infected with HIV in South Africa today. How could they live so close to this reality and yet be so removed from it? Did they not see the townships in the distance and know what was happening, or did they just not care? The more we questioned the roots of their insular perspective, the more we started to realize that we weren't so different.
In the United States, HIV prevalence continues to increase annually despite thorough knowledge about prevention as well as readily accessible treatment. In the past year, there were an estimated 43,000 new HIV infections and 18,000 AIDS-related deaths. Every 9.5 minutes, someone in the U.S. is infected with HIV. Why then is so little attention placed on HIV as a problem in the United States? Like most people in the U.S., we don't really have this epidemic at the forefront of our health concerns. Sure, people wear condoms, but they do so mostly to avoid unwanted pregnancies, not because they're concerned about contracting HIV. Certain populations, namely ethnic minorities, intravenous drug users, and the gay community, are perceived as being at risk. The rest of us simply don't think it is our problem.
This deeply rooted detachment is clearly reflected by the fact that healthcare in the United States is viewed as a commodity, not a human right. While health is one of the most fundamental criteria of a functioning and productive society, our country deems it acceptable to deny people access to treatment and care on the basis of money. To a certain extent, we were aware of the fact that the United States doesn't have universal health care, but we never really thought about what this meant for the people who can't afford to visit the doctor or to pay for the exorbitantly expensive antiretroviral therapy necessary to treat HIV. It's interesting that part of our country's international aid budget enables government funding for healthcare in South Africa, but our country doesn't support those services for its own people.
These observations led us to make the conclusion that, by and large, problems that are out of sight are also kept out of mind. Had we not experienced the realities of the township firsthand on a day-to-day basis, we probably would have exhibited the same carefree attitude the beach-going students in Plet did. However, instead of separating ourselves from disease, it's time to realize that in one way or another, these problems affect all of us. While on the surface it may seem easier not to care, there are dire consequences to this widespread indifference. Beyond the personal moral dilemma of dismissing the plight of others and perpetuating their suffering through inaction, society collectively bears repercussions as well. Decreased school attendance due to infection, a diminished workforce capacity, and lower economic productivity as a direct result of this disease are tremendous obstacles in terms of development. Furthermore, fatalism, apathy, and low morale permeate societies affected by HIV and AIDS in a catastrophic way.
Public health and the well-being of all members of society and the world at large is contingent upon everyone's compassion, willingness to take action, and mobilization of resources and power. Instead of being discouraged by the seemingly distant and daunting epidemic, we all need to acknowledge our role in this global human struggle. As challenging as it has been, this experience has enabled us to question our own assumptions, values, and behavior. If everyone starts to think about how and why they distance themselves from public health crises such as AIDS, these individual efforts can amount to a profound shift in consciousness. In an age with social networking at the heart of our day-to-day interactions, it doesn't take much to spread awareness, dispel myths, eliminate stigma, and promote action and advocacy. So start that conversation, become aware of the problem, and motivate others to take part. If people with resources and knowledge at their disposal don't care or help, who will?